So the partner tool is a way for practitioners to measure and monitor their collaborative activity with other organizations. So today it's really common for public health to work across boundaries, so working with other organizations. And when I started working on the partner tool, I always talked to practitioners about how they were demonstrating to their funders and stakeholders and partners the work that they were doing. How are they evaluating it, or how are they using this work to inform a QI process? And what we found out was that folks didn't really have a good way to do this. And the predominant way that a person was demonstrating their work at a health department or one of their partners was by counting the number of partners. So someone said to me, counting noses one time. So we realized that that's a big burden on anyone in our personal lives or us as organizations to know that we just have to add more partners, more connections to show that we're doing good work. So partner is a way that folks can use the concepts of network science to think about and demonstrate their collaborative activity without just having to say more partnerships is better. So we focus on the quality of the connections, what's exchanged, maybe what's missing, where they can build up ties, but also where they might be able to reduce redundancy. So the tool works like a SurveyMonkey type of tool. It's an online database. So folks, practitioners, there's 4 easy steps. We do a demo once a month and show folks all you have to do is upload who the partners are, customize the survey, administer it, and then the data comes back in online, and then there's a tool that the practitioner puts the data in. And what's really nice is that you don't have to clean the data, you don't have to kind of figure out where to put it or what analysis to do. It's designed so that folks can have a tool that they can use without having to necessarily become a network analyst. So that was really important to us because we also know in this time when there's not a lot of resources, it's really hard to go out and hire an analyst or someone to come in and do a network analysis every time you want to look at your partnership. So this tool is made to build capacity in the health department or in the partnership to do this kind of work, and so to build those skills and make it so that they can do this over the long term. So this has been a real journey to develop a tool. I'm not a computer scientist, and what I didn't realize when I started doing this was there's a lot of programming. So I've been blessed with an incredible team that has taken the tool from being something pretty clunky to something really sophisticated. So in the beginning, practitioners loved the idea. We always had our end users part of advisory committees, or we did interviews. We just always had them giving us feedback so that we were creating something that was useful for them. And so in the beginning, it was that people loved the idea, and they really helped us develop the technology and the program to get it out, to put it out the door. Today, it's really sophisticated. There's been a lot of support. From the Robert Wood Johnson has funded this tool, and now we have almost 500 users. Folks really love it. They give us a lot of great feedback. What's really changed over the last year for us is that we used to know every user. Every user who came to use the partner tool asked us questions, and we would work to provide them technical assistance. Well, over the last couple years, the last actually round of funding from Robert Wood Johnson, we really used to create technical assistance, and so we tried to really think about all the different kinds of users. So we have like a technical manual, and we have web demos, and then we do the live demo. I think we've put a package together that works, because now we have users and we don't know who they are, which is a good thing, because what it means is that people are using it and they have the resources, and we've created the kind of support for them to be able to use the tool without meeting us. And that's been the point, is to build their capacity to do that and the tools for them to be able to do that. So I've actually been really shocked at the way it's taken off and not needed us. And so I think that's good. We have folks who will I'll go to a conference and I'll see someone present a poster and they'll have used the partner tool. And that's really neat, because I know they're practitioners and they found a tool that could let them participate in scientific activities or quality improvement or evaluation work. So the feedback's been really good.